very much for
Enabel agency, which works with Belgium's federal government, that has focused on implementing and coordinating development policies since 2005 in the health and education sector, held the last health project that focused on sharing event experiences and learning. It aimed at analyzing the achievements in Uganda. Since 2019, they have been working with various partners to improve the reproductive and child health care in the country. Sarah Biakika, the Commissioner of Health Services, Finance Policy and Planning at the Ministry of Health, said that the Enabel project is an enhancing health project implemented by USDI. She added that the Enabel, which has been implemented in the 4 districts through financing them to improve the client's needs and also fill in the missing gaps in the health sector.
That funding is supposed to be utilized to improve health service delivery by addressing the performance gaps at the health facilities. So the facilities have been able to embrace this RBF approach, and as you heard, they have been able to utilize this money to improve where they thought they had performance gaps. And this is largely towards improving the needs or satisfying the client needs. For example, procurement of additional medicines to address the issue of stockouts of medicines. Some of them have been able to use that money to procure some basic equipment that was lacking that would facilitate service delivery.
She added that the 33 billion was allocated to the Ministry of Health as the mainstreaming of the result-based financing into the primary health care in the quarterly financial year 2023-2024, and this will be used to sustain these projects in all the health centers 3 and 4 in the country based on their performance in the last year's financial year.
So as the projects ended up, they needed to bridge the gap so that we sustain some of these new learnings and improvements, but using government financing. So still the facilities have integrated it in their work plans so that they can deliver services.
John Francis, among the resident city commissioner Gulu, appreciated Enabel for supporting the health centers and the staff members in the Gulu city through funding them. However, she urged the government to sustain the funding since today marked the last day for the Enabel project, supporting these projects in the beneficiary districts.
By giving us that fund that has helped in renovating, has helped in increasing, the drugs, government is overwhelmed. So they have managed to bridge the gap. So we thank them. Of course, now that they are kind of moving away, it is our prayer that as the door closes, let another window open. And we also pray that government helps us to sustain this, because it has motivated staff and the community has really benefited, and we hope for the better.
Church of Uganda Family TV spoke to some of the beneficiaries of the different districts who have gained from these projects. They have appreciated the Ministry of Health through the result-based financing for the implementations made in the health sector through providing the equipments, dealing with the infrastructure, and also ensuring that there is enough medicine in the hospitals. However, they also shared the challenges they faced during the implementations.
It is very demandful, so it has increased on the workload on the health workforce. So that has somehow also affected the implementation of the project. And then secondly, there are limitations in terms of what to use the money for. You are guided and you can't go outside the guideline.
Government should continue with the result-based financing. We should have a basic amount of funding somewhere, but the rest should be linked to results so that health workers are pushed to do their work.
Biagini Halet, the portfolio manager Enabel, said that the most common issues affecting the health sector are lack of enough employees in the health sector and unprofessionalism, and this has hindered the growth of the health sector in all the districts.
The leadership in the institutions. So in the health institutions, as you know, there are many staff gaps. So many people, well, when we expect, for example, to have 50 people working for a health hospital, you will find that 30 people are present. So we have huge staff gaps and it impacts on the service delivery.